Good morning, everyone. I am Yue Zhong, currently working as a research fellow from Singapore, Asian Research Institute for Society and Education under Nanyang Technological University. I'm here to present my research paper, Development of Synthetic Patient Data to Support Urban Planning for Public Health. First of all, I would like to thank the eCAADe's organizer and all the sponsors to provide me with the opportunity here. Healthy urban planning means plan for people. It promotes the idea that the city is much more than buildings, streets, and open space, but a living, breathing organism, the health of which is closely linked to the citizen. In the other word, it considers the needs of people and communities during the plan process and the implication of decisions for human health and well-being. We also understand that health is multifactorial, influenced and independent by a wide range of factors that act in combination with various relative weightage. In general, a research study carried in 2014 concluded population health is shaped 10% by the physical environment, 20% by access to the quality of health care, 30% by health behavioral, and 40% by social and economic factors. In order to understand the health by urban planning factor like land use, densities, etc., we need to access the real electronic health record. However, the real data is hidden by legal, privacy, security, and intellectual property restrictions. The lack of freely distributable health record become one important issue for urban planning process. So my research question here will be how to develop a set of freely distributable health record from an urban planning perspective, which include planning variables like residential density, land use, street connectivities, etc. And to narrow down the scope of general health, here for this pilot study, we choose type 2 diabetes as a health outcome. This research methodology includes 3 steps. First, review and meta-analysis the urban planning factor impact on the prevalence of type 2 diabetes. Second, we generate synthetic patient data through a top-down and bottom-up approach. And finally, we evaluate and visualize the synthetic patient data in a web-based GIS application. The evaluation compares the annual prevalence of type 2 diabetes by age and gender group with public available health data in Singapore. For meta-analysis, we have registered the systematic review protocols in Prospero website, which is public to all. From the meta-analysis results of residential density, we found higher residential density was associated with higher type 2 diabetes risk. It suggests that people living in the higher residential density area had a 4% higher relative risk of developing diabetes. From the meta-analysis results of land use, we found that the urbanization was associated with a higher type 2 diabetes risk. It suggests that people living in the urban area have a 6% higher relative risk of developing diabetes when compared to those who living in the rural area. From the meta-analysis of the street connectivities, we found the higher street connectivities trend to be associated with lower type 2 diabetes risk. This fund suggests the street connectivities may be protective against the development of type 2 diabetes. People living in the highest street connectivity location had a 18% lower relative risk of developing diabetes. compared to those who live in other areas. Based on the findings of systematic review, we use the existing simulation framework, which is a realistic synthetic pattern to generate the synthetic patient data for Singapore. From the results, comparing the prevalence of type 2 diabetes with age group and gender from the patient at 3 years, 1998, 2004, and 2010, the synthetic results roughly approximate age group curve. In other words, it correct generate more than 80%, more than 90% of patients for all age group in Singapore. So we also developed a web-based GIS application to visualize the generate synthetic patient data. The current data can be downloaded by different regions. It also offers an opportunity for urban planner to link plan process with public health. Thank you for listening to my presentation. Please let me know any question on this one. Thank you.